Yeah, I can hear you.
Yes, sir. I'm sharing my screen, sir.
Yeah.
Can you see, sir?
Yeah.
Yes. Good evening, sir. My topic is on blood and blood products. One minute, sir. My screen is loading.
Take your time.
Yes, sir. Sir, I will be discussing my topic on introduction, functions of blood components, blood products.
Utilization.
One minute, sir. Blood products utilization and conclusion. Blood is connective tissue fluid, which is a fluid for life. That is, it carries oxygen from lungs to all parts of the body and carbon dioxide from all parts of the bodies to the lungs. And it is also a fluid for growth, which carries nutritive substances from the digestive system. And it's also a fluid for health, which protects the body against diseases and gets rid of the excretory substances via kidney. These are some of the functions of the blood, where it functions as a respiratory by carrying the gases from the lungs to the tissues. And it also functions as excretory, transporting the waste. And it also functions as a regulatory, regulating the blood temperature, regulating the pH, regulating the water content by cells by interacting with dissolved ions and proteins, and also transporting the nutrients from the blood to the tissues. And it also plays a protective role by the white blood cells, antibodies, and antitoxins. Coming to the blood components, whole blood, which constitutes 80%, and other fluids and tissues, which constitutes about 92%. The whole blood contains blood plasma and the formed elements. Blood plasma, which constitutes about 55%, and the formed elements constitutes 45%. Blood plasma includes proteins, water, and other solutes. Proteins include albumins, globulin, fibrinogen, and other solutes like electrolytes, nutrients, gases, regulatory substances, vitamins, and waste products. Whether formed elements includes platelets, white blood cells, red blood cells, neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Coming to plasma, plasma constitutes about 90. It's a chocolate fluid which contains 90% of water and 7% of plasma proteins, whereas 2% constitutes about the nutrients, electrolytes, gases, hormones, waste, and waste products. It also includes albumin, which maintains oncotic pressure, and fibrinogen for clotting, and immunoglobulins for which contains antibodies, which helps in immunity. Coming to the blood product separation, blood products are separated by centrifugation, which includes light spin and heavy spin. When the blood undergoes light spin, it can be separated into platelet-rich plasma and an RBC concentrate. Whereas when it undergoes heavy spin, it up to about 4,000 to 5,000 in for 10 to 15 minutes at 22 degrees Celsius, it can be separated into platelet poor plasma, RBC concentrate, plus buffy coat. Platelet rich plasma can further be separated into platelet poor plasma plus random platelet concentrate, which can undergo rapid freezing and storage at less than 25 degrees Celsius to fresh frozen plasma. Whereas buffy coat can further be separated into random platelet concentrate and a buffy coat paste. First, blood product, that is the RBC, erythrocyte preparation. Erythrocyte preparations can be packed RBCs, washed RBCs, leukocyte poor RBCs, frozen RBCs, and leukocyte preparations include granulocytes, mononuclear cells, and platelet preparations. And plasma fractions include fresh frozen plasma, cryoprecipitate plasma, factor 7 concentrate, factor 9 concentrate, antithrombin 3 concentrate, and prothrombin complex, albumin, and intravenous globulin. Coming to the packed red blood cell, it is mixtured prepared from anticoagulated whole blood, and each unit contains 200 ml RBC with a plasma of less than 50 ml, and it increases the hematocrit of 55 to 60%. Indications include anemia, where the hemoglobin is less than 7 gram per deciliter, The decision of transfusion whenever the HB is above 7 depends upon the cardiopulmonary list, ongoing blood loss, and the clinical judgment. The transfusion trigger for MI and emphysema is hemoglobin less than 10 gram per deciliter, whereas in mechanically ventilated patients, HB less than 12 gram per deciliter is the transfusion trigger. An acute loss of less than 1,500 to 2,500 ml. The dosage is each unit increases by 1 gram per deciliter, that is 15 ml per kg can be given, and it can be reconstituted with crystalloids or colloids without making it hypotonic, because there is a risk of hemolysis, and calcium. The risk of addition of calcium causes increased clotting of the blood. Coming to the leukocyte poor red blood cell, it is manufactured, that is, it is prepared at the time of procuring or transfusion by specialized filter, sedimentation technique, and inverted centrifugation. The outcome is RBC. The RBC concentrate will be about more than 99.9%, and the WBCs will be very less, that is less than 5,000 millimeter cube. Indications include patients with recurrent febrile reactions. It is used in patients requiring frequent transfusion to reduce HLA antigen alloimmunization and prevent transmission of cytomegalovirus and graft versus host disease. Next comes the washed red blood cell. Packed red cells are washed with saline by manual centrifugation or continuous flow preparation. It removes 99% plasma proteins, electrolytes, antibodies, and should be used within 24 hours of preparation to avoid bacterial contamination. And the indications include hypersensitivity to plasma or allergic to whole blood, patients with recurrent allergic or febrile reactions, neonatal transfusion to reduce quantity of metabolic breakdown products, risk of CMV transmission, and to avoid graft versus host disease, and also in patients at risk of hyperkalemia and multiple transfusion patients. Coming to the frozen red blood cells, after addition of cryoprotective agent like 10% glycol, so frozen red blood cells can be made. RBC can be stored continually below freezing the temperature, that is less than minus 80 degrees Celsius. The shelf life for frozen red blood cells is 3 to 5 years. And indications include ready supply of metabolically superior RBCs. Freezing arrests the biochemical changes occurring during liquid storage. So frozen red blood cells can be used in a non-hemolytic, that is, it causes for rare blood group conditions can be used. It causes reduced incidence of non-hemolytic reactions, sensitization to HLA antigen, transfusion hepatitis. And the main indication is rare blood, which where the frozen RBCs can be made readily available. Next comes the irradiated red blood cell. It is manufactured by gamma irradiation with 25 diet. Prevents lymphocyte proliferation, and thereby it prevents transfusion associated graft versus host disease. And indications include congenital or acquired immunodeficiency, stem cell transplant recipient, HLA matched products, transfusion from relatives, granulocyte production, and fetal and neonatal transfusion. Coming to the leukocyte preparation. Leukocyte preparations include granulocyte preparations and mononuclear cells. Granulocyte preparations include collection of granulocyte, that is from 5 to 10 liters of the blood. It requires processing from 5 to 10 liters of blood. Indications include absolute granulocyte count less than 500 cells per ml, fever, unidentified microorganisms, no reduction in fever after 48 hours of antibiotic therapy. Next comes the mononuclear cells. Cell separator techniques facilitate processing large quantities of blood from to collect the stem cells. And indications including AML, where therapeutically used for bone marrow transplantation for AML, Hodgkin's lymphoma, multiple myeloma, CA breast ovaries, and neuroblastomas. Next, coming to the platelet preparations. Platelet preparation types includes apheresis platelets, platelet concentrates, lymphocyte depleted platelets, and ultraviolet B irradiated platelets. Apheresis platelets is nothing but collecting more platelets from one donor to avoid multiple donors, whereas platelet concentrates is collected from multiple donors. Platelet concentrates are manufactured from the whole blood by centrifugation, as I said before, and it contains 55 billion platelets suspended in 50 ml of plasma. And it can be stored at 20 to 32 degrees Celsius under constant agitation for 5 days. And it is the only blood product which can be stored at the room temperature. 5 to 6 platelet concentrates can be pulled to obtain from the The doses include 5 ml per kg or 6 units of platelet concentrate, which increases the platelet count by 50,000. And ABO compatible blood is used wherever possible, but ABO incompatible blood also can be equally effective. Indications is platelet count, which is less than 10,000 per millimeter cube in non-bleeding patients without other abnormalities of hemostasis, and platelet count from 10,000 to 50,000 for lumbar puncture, epidural anesthesia, central venous access, liver biopsy, vaginal delivery, and surgeries. Platelet count, which is less than 75,000 to maintain that is more than 75,000 per millimeter cube during the management of massive blood loss. A platelet count of 1 lakh in intended procedures where closed cavity bleed may be especially hazardous, like neurosurgeries, and microvascular bleed due to platelet dysfunction in uremia, cardiopulmonary bypass, and massive blood transfusion. Contraindications: the diseases associated with platelet activations like thrombotic thrombocytopenic purpura, heparin-induced thrombocytopenia, administration of platelet concentrates increases the thrombosis, and idiopathic thrombocytopenic purpura unless life-threatening bleeding occurs. Prophylactic administration includes massive blood transfusion and after cardiopulmonary bypass. Adverse events like infection, especially if stored after 5 days at room temperature, and suspect transfusion-related sepsis if fever occurs within 6 hours of transfusion. And platelet refractorants, like suspected if poor increment in platelet count 30 to 60 minutes after transfusion, which occurs due to hypersplenism, DIC, antibodies to HLA, and antibodies to platelet-specific antigens. Coming to plasma fractions, fresh frozen plasma. FFP it is a fluid when fluid position of centrifuge is thawed within 6 to 8 hours, FFP is obtained, and plasma frozen for 24 hours after phlebotomy is called FP24, which is comparable to FFP except 25% reduction heat and levels will be present in FP24. It is obtained by apheresis separation of plasma from centrifuge to whole blood, and plasma is frozen at minus 20 degrees Celsius. And each unit of FFP is prepared from 1 unit of blood will have 200 to 250 ml. The shelf life of FFP is 1 year frozen and 24 hours thawed. Contents include factor 4, factor 5, factor 7, factor 8, factor 9, and it is rich in factors 5 and 8, and it contains 1 international unit per ml of each factor, protein C, S, and antithrombin 3, electrolytes, albumin and immunoglobulins, and complements. Indications for FFP include urgent reversal of warfarin therapy, replacement of isolated factor deficiencies, which is used in specific concentrates can be where specific concentrates are unavailable, like factor 7, factor 5, factor 8, factor 9 and 10, protein C and S, antithrombin 3 deficiency, and treatment of hemolytic uremic syndrome, disseminated intravascular coagulation, thrombotic thrombocytopenic purpura, massive blood transfusion if prothrombin time and APTT is more than 1.5 times the control. Contraindications include it should not be used for the augmentation of plasma volume for augmenting the albumin concentration. Avoid administering PRBCs and FFP to same patient as it increases the risk of infections. In such cases, one can give whole blood if required. And the dosage is 10 to 15 ml per kg FFP to achieve minimum of 30% coagulation factor concentration if there is clotting factor deficiency therapy, and 5 to 8 ml per kg of FFP for warfarin therapy reversal. Fresh frozen plasma need not be of the same RH type. Coming to the cryoprecipitate. It is prepared as cold insoluble precipitate by thawing FFP at 4 degrees Celsius and removing the supernatant. And 1 unit of cryoprecipitate will have the volume of 10 to 20 ml only. And its shelf life is 1 year frozen and 24 hours thawed. And the contents in the cryoprecipitates are principally factor 8, factor 8 and 4 to 60 international units of factor 30, 1 milligram factor of 8 international units, 100 to 250 milligram of fibrinogen and fibronectin, and trace of other plasma proteins will be present. Antibodies and cryoprecipitates are present in very low concentration. Indication of cryoprecipitates includes treatment of hemophilia A, treatment of fibrinogen deficiency, like congenital, which can be congenital acquired, DIC, massive blood transfusion when fibrinogen levels is less than 80 to 100 milligram per deciliter, von Willebrand disease, factor 13 replacement in sepsis, trauma, burn, bleeding due to uremia unresponsive to desmopressin, and it is used to trap calculate in renal pelvis to facilitate pilotomy removal as a fibrin sealant if fibrin extractor is not available. And adverse events include preparations may contain RBC fragments with RHO antigens. So one should be cautious, and this may sensitize RH negative individuals to RHO antigen. And dosage 0.2 unit per kg increases fibrinogen by 50 milligram per deciliter. Units are usually pooled, and ABO compatible units preferred, but it is not very important as concentration of antibodies in cryoprecipitate is very low. Cryoprecipitate need not be group specific. When SOC is thawed and supernated forms cryoprecipitate, and the precipitate contains fibrinogen with added thrombin. This is locally applied as fibrin glue to achieve hemostasis. Indications as a hemostat for all surgeries, as an adhesive for skin gaps and facial flap attachment, and also as a sealant for colon sealing. Next comes the albumin. Albumin source is a whole blood serum placenta. It contains 96% albumin and 4% of other proteins, available in 5% and 25% solution in saline. Indications: hyperproteinemia, burns, peritonitis, and for volume expansion acutely. It can be used without regard ABO type and cross matching, and should be administered without 4 hours of starting infusion. Adverse events include allergy, and it is a little expensive, and there is high risk of bacterial sepsis and Creutzfeldt-Jakob disease. Next, the intravenous immunoglobulins. It is prepared from pools of plasma fraction to create concentrated immunoglobulin products. It is mainly IgG, which is virally inactivated. Indications include hematological conditions like hypogammaglobulinemias, acquired RBC aplasia, HIV-associated thrombocytopenia, ITP, and post-transfusion purpura. Neurological conditions like acute disseminated encephalomyelitis, dermatomyositis, Guillain-Barré syndrome, Lambert-Eaton syndrome, and myasthenia gravis, and viral infections like cytomegalovirus and pediatric HIV. Adverse events includes anaphylaxis, especially in IgA deficiency, headache and febrile reactions, and renal failure. Coming to antithrombin 3. Antithrombin 3 manufactured from factor 9 recovered from plasma by absorption with ion exchange. These are the complexes with of vitamin K dependent 2, 7, 9, and 10. Indications include congenital and acquired antithrombin 3 deficiency, inadequate heparinization despite adequate dosing while using in cardiopulmonary bypass, recurrent thrombosis is observed despite adequate anticoagulation, and in shock and DIC. Other indications of and dosage include it is infusion of 50 units per kg will increase antithrombin 3 levels to 120% of normal. The antithrombin 3 levels in plasma should be kept at levels of more than 80%. Prothrombin concentrates are also available, and indications include hemophilia B, factor 9 deficiency, that is Christmas disease, and acquired hypothrombotic bleeding disorders like warfarin overdose. Thank you, sir.
Okay. It's a very elaborate presentation, Jayabharathi. Congratulations for that painstaking preparation.
Yes, sir.
But in the exam, when they asked about blood and blood products, I feel that may not have time to go through and write all these details that you have. It's good for having a knowledge about it, but it should be more practical oriented presentation.
Okay.
because in the exam they are not able to know what blood product to use in which particular condition. So it is better to highlight like that, and then we must be aware of what is the volume in which they are available, how they have to be stored, how soon you have to keep them out of refrigeration and use it, and what are the various indications for that. That is what the examiners expect from you.
Yeah.
So, without I this this is really an enlightening preparation that you have made uh, for everyone to have a knowledge